weather is influenced by the geographical location, as well as also by the solar radiation and the ocean current, and also the human activity. I said the environment where all these operate, so how the pattern is influenced, this is what influence the climate patterns, which leads, in fact, to the extreme weather events. So the extreme weather event or hazard is, as you all know, is the severe occurrence, which deviates from the natural process. What we have said in the first slide is the natural process. Because of the human activity and the climate change, the extreme weather event is happening. It's because of the natural course as well as exacerbated by the human activity. So in the ecosystem in general, to get those ecosystem service in an unbalanced way. So, and also the climate change is a long-term change, as you all know. I think you have already covered. I'm not going to go through this one. And then the global warming is, this is very important, which is happening since the industrial revolution from the pre-industrial. I would like to encourage all of the colleagues participating on this course to read through this to understand very well. So it is happening, the change by temperature, which in fact impact the weather events, we call them, which exacerbate the extreme weather events apart from the natural occurrence. The major impact of the climate change is, as you all know, you have already covered this one, the rising of the sea level. I highlighted this in yellow color, which also exacerbates the coastal storm and the flooding. And then at the same time, increasing the frequency and the severity of the extreme weather events, such as the tropical cyclone, flood, drought, and heat waves. And also the change in precipitation patterns also affect the water supply, the agriculture, the loss of biodiversity is all what is happening due to the climate change and lead to the extreme weather events. So let me, okay. So these are due to the increase in frequency of the climate change impacted the weather event by increasing the frequency and the intensities. Typically the cyclone, the flood, the wildfire, drought, heat waves, all these, I highlighted the weather pattern in yellow colors. You will see the flood is due to heavy rain, storm surges, tropical cyclone, and tsunami in coastal areas is happening also because of the extreme precipitation. And also, if you look at the wildfire, it's because of the high temperature. And the drought is lack of the precipitation, and then the heat is due to excess heat. All these are the weather pattern, but because the warming, which leads to the climate change, is exacerbating all these apart from the natural occurrence. We need to understand very carefully the event is happening naturally, but it's exacerbated by the climate change. So if you look at over the last 10 years, 18 to 19% of all documented disasters are from the natural hazard due to floods, drought, tropical cyclone, heat waves, and a severe storm, which is due to the exacerbation by the climate change. So, what are the direct impacts? So, some of the studies show that over the last 20 years, more than 2 billion people were affected worldwide by the flood, and 55 million people were also globally affected by the drought. And then also the heat waves, which is mainly in Europe and Asia, 45% of these are in Asia, and also 36 are in Europe. The first two is very common in Africa, which affect is from the Africa. So you will see all these impacts. So what are the short-term and the long-term health threats impacted by the climate, by the extreme weather events? So all these, the number mentioned in the previous slide is manifested as injuries and the fatalities, such as because of the flood, because of the hurricanes and the wildfires, and also the heat-related illness, which is a short-term health threat, respiratory issues from the smoke, poor air quality, and also the respiratory problems, waterborne disease, as you all know, the floods can contaminate the water supply, which lead to the outbreak of disease like cholera, diarrhea, and the typhoid and the others. These are a very common in the African region. And also the damage, the long term is also the chronic respiratory conditions, mental health issues because of the property damage and the family loss. All these people get stress and trauma from the extreme weather events, which lead to long-term mental health problems, including anxieties and depression. The other is a vector-borne disease, typically the malaria, dengue fever, and also yellow fever, and also the nutrition deficiency because of the drought and other extreme weather events. Even the flood can destroy the livelihood and the properties, so that people are getting, in most cases, undernutrition. This is also common in Africa. So the combined short-term and the long-term threats makes Africa particularly vulnerable to the impact, given it is diverse climate pattern, which is varying from weak economic structure, economic and the structural factor, including lack of resilience in Africa. So this is from the European extreme weather monitoring. You can see the challenge in African region. You will see the dimension, the vulnerability, the hazard and the exposure in terms of dimension. You will see the vulnerability and also lack of capacity. So you will see in the category, you will see the natural, the human, in terms of hazard and exposure. In terms of vulnerability, you will see the socio-economic and also the vulnerable group. And then in terms of lack of complete capacity, you will see the institutional and the infrastructure. So you will see in the natural category, earthquake, floods, tsunami, a tropical cyclone, drought, and also epidemics. And then in the humans, the conflict, the political conflict, unrest, and all those things impacted also the extreme weather event. When the extreme weather event happen in those areas, is the people are vulnerable because of the conflict and the unrest and also those things. So it is a combination of the natural and then the human. And then we have the vulnerability and the dependency. And also the other thing is lack of dependency on aids, and then increasing inaccessibility, the socioeconomic factor, dependency, and then lack of capacity, the infrastructure, all the economic, everything will come under the economic, socioeconomic factor. So the vulnerability is uprooted people, the poor, the vulnerability, the poor, and then other vulnerable groups. So the children, the elders, and also the age factor all come under this vulnerable group. And the institutional, the disaster risk reduction. You remember, most of you might be aware of the Sendai framework. There is a 7 targets, which I'm going to touch later on. So how the disaster risk is functioning in a given area, the governance. So, and then the infrastructure, you will see the infrastructure also the lack of the physical infrastructure, access to health system, all this makes Africa more vulnerable to this. So you will see most of the very high and then high countries are from Africa. You will see the very high and the stable, and then you will see on this slide very high and increasing. So both are in Africa, those very high and increasing. Is among the 14 countries, only 4 countries are outside of the African continent. So then I would like to highlight also in terms of the impact, overall impact, during the last 2 decades, the African regions, the health emergency is related to climate-related extreme weather events. 56% of those health emergency happening in Africa is due to extreme weather event related to climate change. You will see the natural disaster, vector-borne disease, waterborne disease, and the zoonotics. In terms of those extreme events, cyclone, drought, flood, in terms of the epidemic, cholera, malaria, and undernutrition, and the others. So the cyclone is common, which is happening following the extreme weather event. As a mass, you will see cholera, diarrhea, malaria, and undernutrition after those. So we have seen how it operates and then what is the impact. So we need to see also, as Dr. Charles already mentioned in the introduction, what are the biological, social, economic factors? The biological factors, age is very important. The young, the infants, and also the old, and also pre-existing condition, people with underlying cause with a chronic illness. Those are the biological factors which can exacerbate the impact of extreme weather events. I've already tried to touch the social factors, the poverty, employment, and also lack of resource, the education, limited access to education, and also awareness, and then for preparedness for extreme weather event also is the social factors. The social networks, how people are communicating, where we have we have a good traditional network or modern network like telephone, access road, and also then this also contributes to the vulnerability of those exposed, having exposure to those extreme weather events. The economic factors, you can see the economic factors, job insecurity, lack of employment, and also lack of capacity, economic capacity to take a precaution, and also the housing, the poor housing, as you can see on this, from those who are living in a slum area where the area is prone to floods, for example, they are the most affected one. And also the social factor, the structural factor, the infrastructure, inadequate infrastructure, such as poor drainage system, and also lack of access road, and also lack of resilient infrastructure contributes as to the vulnerability of those having exposure to those hazards, to the extreme hazards. So as a structural factor, healthcare access is also very important, which is the limited access to healthcare service, hinder timely medical and medical response in the recovery in terms of exposure, poor urban planning, and also in a rural area, it affected the agriculture, the house structure, the very weak house structure they are having. So this is the structural factors. In summary, you will see the external drives. The external drives is climate change, extreme weather event, and you will see the socio-economic determinant of public health, which we have mentioned before. You see the challenge, and then the challenge is the climate change is uncontrollable on the medium term, even on the medium and both on the short term. especially for the developing country, as we are contributing. I hope you have touched in the first session yesterday, before yesterday. So this socio-economic determinant of the public health can be modified on the short term to medium term. So that is why we need to have the adaptation health or national adaptation plan, where health is as one of the sector to have the health national adaptation plan to address the socio-economic factors. So, and then the vulnerability exposure to the climate geographical characteristics is very important. That is also uncontrollable. We need to have the adaptability, adaptive capacity, and the readiness. So that is why really this course is very important. Then we have the internal drives, knowledge and the value, human safety, public health infrastructure, and investment. Knowledge transfer. This course is very important because we need to transfer the knowledge to adapt to what can be modified in a short and medium term. So we have also the vulnerability aspect, as I said. We need in the vulnerability, as I said before, for the external drives and the internal drives, we need the adaptation. We need to have the resilience system also, which can be modified in short and the medium term. So in general, we need to have the adaptation plan, which can facilitate the resilience of the system, including the health system. This is on the right side is the impact of the climate change, which you can see the extreme weather event also. So I will go quickly to the role of disaster risk reduction, public health communication, regional cooperation to prevent the health impact. So the disaster risk, most of the countries, they have a disaster risk commission. In my country, that is the example. We have the disaster risk reduction strategy where we have health is part of it. So I think one of the important, the disaster risk reduction commission, the typical example, for example, in Ethiopia, they used to have every 6 months seasonal assessment, all sector. It is a multi-sectoral seasonal assessment to address those risks. So they have to do the risk assessment and then the mitigation measure. So based on the risk assessment, they need to develop the mitigation action. So they have to have also community preparedness. They need to work based on the evidence. And also they need to work on the humanitarian nexus development, including mainstreaming of integrated development and the humanitarian response plan. This is the role of the disaster risk reduction. And we need the public health also. For example, in Ethiopia, there is a public health institute which is responsible for the health surveillance, including the emergency response, and also in the health sector managing the disaster risk, and working very closely with the National Disaster Commission. So they need to create awareness among the public health practitioners, the community, and also they have to guide the behavioral change for the community to prepare and stay safe, because the health system is reaching up to the community and the village level. It is a good opportunity that they create awareness campaign and also work on the behavioral guidance, because they are very close to the community. They are working daily with the people at grassroots level. So it is an important role the health sector is involved with in these areas. Then the early warning. We have the national early warning for all sectors. And there is also the early warning as part of the health surveillance system. We need to integrate the climate services where the health sector is informed on a daily basis or on a weekly basis with the climate information, climate pattern information, so that they can link with the epidemiological data to see the trend. For example, what is happening to malaria during the dry season, during the rainy season, and also to cholera and the diarrhea. We have, for example, in this early warning, an alert and the response for Ethiopia on the climate sensitive disease, where we are implementing over the last 6 years with very close to 20 sentinel sites. So this is very important, forecasting those climate sensitive disease, and also timely alert, and then coordination to respond and then to recover from them. So in this area, the health sector is working very closely in Ethiopia with the meteorologists. There is a memorandum of understanding where they are getting the data to do this forecasting. And now we are moving to the nationwide, because we recently managed to put in place the server for the whole countries. So in this regard, the role of the health workers, in summary, you can see from the depicted table, is to educate the public, enhance monitoring, contribute to public dialogue, and then we need to have a mini research. For example, the health facility, those who are working in the health facility, the doctor, the public health officer, the nurse, when the trend of diarrhea is increasing, they have to ask what is happening in the community. When the trend of malaria is increasing, they have to do a mini question, why it is increasing from last week, this week. This is a kind of research. It should not be always like the university research. So we need to train the health workers to do this in their respective catchment area. So this is very important, and I would encourage colleagues to read on this, because on all areas, I will tell you the reference, how you are going to the reference. So the other thing is the role of the regional cooperation. In this area, there is the need of regional cooperation between the neighboring countries and also regions, and even between district and between subnationals, and also global. So this is a resource sharing, especially from the global community, and also internally for the disaster reductions. And the joint planning, as well as mutual aid, is very important in the regional cooperation to address this gap. So by integrating these components, society can be better prevent the health impact of extreme weather event and ensure resilience of the health system and the population. So then what are the relations between the climate change, international migration, and also population health? As you can see, the climate change and the migration, the climate change can increase the intensity of the extreme weather event, and then the extreme weather event can lead to internal migration as well as external migration. So prolonged, this can be because of the flood due to prolonged droughts, and also landslide, the national, and also people may be forced to move internally within their country, also across the international border in search of safe living condition and a better livelihood. So, and then migration can be, whether it is voluntary or forced, it has an implication for the population health, including the challenge due to the stress on mental health, as well as also other diseases, physical injury, mental health, increased vulnerability to infectious disease like diarrhea, malaria. All these during the migration, people, those are in migration because of the lack of the coping capacity, they are more vulnerable. And also the immune, especially in this case, as we have mentioned, the biological factor, the age issue, and all those things contribute also in the migration. So this is very important. This is the linkage. So what are the multifaceted or multivalent interaction in this case? The direct health impact can be directly affect the health through heat-related illness, respiratory problem from poor air quality, and the injuries from extreme weather events. The indirect impact can be exacerbated food and the water insecurity, which lead to malnutrition and waterborne disease. It can also increase the risk of vector-borne disease as changing temperature and the precipitation pattern affect the habitat of the disease-carrying insects. That is why I just, in my previous slide, talked about the habitat, about the ecosystem. These all events bring change in those and then facilitate the disease-carrying insects proliferation. So the social determinant, also the migration influenced by the climate change, often intersect with other social determinant of health, such as socioeconomic status, because the migrant, the economic status is low, the access to education is low, and also the social support network is broken because of the migration. And this factor can either mitigate or exacerbate the health outcome of the migrant. If it is managed properly, it can be mitigated, but in most cases, we used to show that it exacerbates always. So for this, we need the policy and adaptation. We need to have a policy related to climate events for migration, which requires coordination of policy response, strengthening health system to be climate resilient and migrant inclusive is very important. This includes improving access to health care for migrants, enhance disease surveillance, and developing strategy to address environmental and social determinant for the migrant. In most cases, sometimes when there is a response, we need to address also the host community, because especially whether it is internal or external migration, we need to address this with the host community to avoid the conflict of interest, because they are moved to someone niche. So they need to sometimes, because of the aid, they are better off than the host community, and creates some conflict of interest from my experience. I worked a little bit with the Sudan refugees in Gambela in Ethiopia. When I graduated from university, that was my first work. So it is very important to address. Then I will move to the conclusion. Then for this, we need to strengthen the resilience system of the entire multi-sector. It is not only health alone to address the extreme weather event hazards. This can be applied to communities, organizations, or other systems, including the health systems. The health system building blocks, the 6 building blocks. I would like to emphasize here in my conclusion on the capacity building for mainstreaming or integrating resilience building. We need to build the individual capacity, the institutional, and then the system capacity, because climate is changing. The climate change, if you remember, uncontrollable, and then it's very difficult to change in a very short term and long term, medium term. So we need to adapt. For adaptation, we need the capacity building for the health worker and for the entire system. For example, most of the health workers, are they aware of the climate sensitive disease while they are serving the community? We need to create, because it's not there in the pre-university education. So we need to go to the level of curriculum revision as well as to the in-service training like this. And then we need to strengthen the multi-sectoral coordination and partnership mechanism for joint planning, implementation, reporting, and reviewing with the mechanism for continuity of this multi-sectoral coordination, even with the accountability issues. So we need also to have a resource through the regional cooperation and also internally. As you can see, this is which came from the WHO Health Operation framework. When the stress comes, the normal response is going to, due to the shock of the extreme weather event. If the system, as I said, the individual, the institution, the system is prepared they will respond and then keep it to the normal level. But in most of the case in Africa, it is getting collapsed. So we need to recover, but more than before. There is recovery, but it is worse than before. And then we have a normal if preparedness is okay. But in terms of those vulnerable areas, we need to move above normal, advanced level, because we need to ensure the resilience through adaptation. That is why we need vulnerability in the adaptation assessment for the climate change, including the vulnerability assessment. I think in this course, this is going to be covered. That is what I used to work for the last 13 or 12 years on the vulnerability assessment and also health adaptation, both in Ethiopia and Mozambique, and sometimes supported other countries like Botswana and other countries. So really, we need to have the vulnerability assessment and to identify in terms of locality so that we can prepare to push when the shock comes, the system is resilient to cope with what is happening. So I encourage colleagues to read this from the operational framework. So the other conclusion is we need to avoid working in the silo, such as humanitarian versus development, single sector versus multi-sectoral, because in most cases when these extreme events happen, a lot of resources is coming in, they do the response and they go. And then the event come again. Just we like when the pipe is broken, rather than fixing the pipe, the tap, they continue, mopping. I used to call them, this is mopping. We need to move from that. And then we need to look at how we are going to really look humanitarian nexus development. So in this case, it's very important to look in a holistic approach, the climate, mainstreaming climate resilience, disaster risk reduction, and then sustainable development in a wider global, national, and the local development programs. We have, in the Sendai framework, we have 7 targets, of which 4 of them are focused on reducing, and then 3 of them are focused on building capacity. So really is very important. For example, global disaster mortality reduction, number of affected people reduction, and economic loss reduction in terms of relation to the GDP, reducing damage to critical infrastructure and the service disruption. We mentioned this in the biological, structural, economic factor. And then the other one is the number of countries with the national and the local disaster strategy, international cooperation to develop countries, availability and access to early warning system, and the disaster risk reduction information. You see in the role we have already mentioned. In the sustainable development, we have 17 sustainable development goals. All these contribute to the resilience, which can really to cope when in an areas where the locality and the people are vulnerable to extreme weather events. So these are very important working in integrated manner. So for the response. This is the reference. I try to, for colleagues, for all participants to read. I all put under the note under each slide a link. So when you go all this, I brought from the reference. So because you need to read on those things. Finally, I will conclude my presentation with why Africa is particularly vulnerable to the extreme weather event. I think my colleagues is going to be work is coming in on this issue. Is because of the geographical and the climate factors, high level of poverty, dependency on the rain-fed agriculture, limited adaptive capacity, poor infrastructure, the governance problem and the preparedness, and also because of the climate change, Africa is most vulnerable to the extreme weather event. So to address this, we need to strengthen the early warning system for the health sector, and also the health sector in a coordinated and integrated manner with the environment, with the meteorology, with the agriculture, and all sectors. So we need to improve infrastructure, and we need to enhance also agriculture practice rather than depending on the rain-fed agriculture. Investing in climate adaptation, as I said, I would like to stress this one. The country needs to have the vulnerability assessment by local, at least at the district level, and then based on that adaptation option. And then number 5 is strengthening the governance and the policies. And the number 6, we need to build on the community resilience. And then we need to work on the international cooperation and the funding for the Africans to ensure the resilience of African community, including the global community, to impact of extreme weather event, which exacerbated by climate change. I thank you all. This is my presentation.
Thank you so much, Kutane, and thank you, colleagues. I've seen the questions coming, and the chat group has been very active. Thank you, Kutane, for those very experiential presentation. And so we'll turn it to continue to bring in your questions. We take those at the end of the presentation. But let's bear in mind, just like Kutane had said, what is within our areas, our spheres of influence, and try to work around them, looking at resilience and adaptation. I'm going to turn it over now to Dr. Peter to take us through his presentation. Thank you.
Okay, thank you. Good afternoon to all, or good morning. Here in Cameroon is afternoon, so
Sorry, Dr. Peter, if we can do this in 20 minutes so that we can have more time to interact, that'll be very helpful.
Okay, we will try it. Let me quickly share my screen. Okay, so thank you. I'm Peter Mbondji, and I'm going to introduce you in a case study on extreme weather hazard on tropical cyclones and flooding in Africa. So first, I will just quickly go through an historical point of situation about global warming, which is causing an increase in the frequency of intensity of storms in Africa, which are exacerbating other socioeconomic stressors and things like that. So in terms of extreme weather events, actually, we have noticed that in Africa, there is only about Africa is contributing for about 4% of global greenhouse, and but still, yet it is on the front line of the consequences of the global warming. What we have noticed also in terms of historical effect of global warming is that increase of global temperatures leading to extreme weather patterns. And we can see the increase in the temperatures in Africa, which are above the historical patterns since the years 80s, and which have created, a shift in the pattern of extreme weather events. If we consider the different hazards in the African countries, we have first, among the first hazard, drought, but followed by the flood. So the flood is also linked with the temperature increase and the change in precipitation patterns. We can see that these three together are really the ones that are affecting Africa the most. So since 2000, since the past 3 decades, there are more than 2,000 catastrophic disasters on the African continent due to extreme weather and climatic disaster. This is mostly linked to the shift of from predictable to more erratic seasonal rainfall, more frequent and intense drought in some regions, and then the growing intensity of storms and cyclones due to warming ocean temperature. The related disaster, the rain-related disaster in Africa is rising, and the flood has accounted for 60% of the disaster recorded in Africa, especially in sub-Saharan Africa. We can see that this flooding is concentrated in East Africa with South Sudan, Somalia, Kenya, and other countries in Africa. They are the ones really having the largest number of people affected by floods. Reflective of the unpredictability of flooding from year to year, actually the list has been adjusted, and also in Central Africa now, some of the countries, Central and West Africa, are also seriously affected or impacted. In Sub-Saharan Africa, we can notice that this is the only region in the world that has recorded an increasing rate of flood-related mortality since the 90s. And in 2020, floods affected 8.1 million people and caused more than 1,200 deaths. So these floods mostly comes from storms and cyclones. Since the 70s, we have noticed that the storms have been multiplied by 4, while the cyclones were multiplied by 2. Which makes an average of 3 cyclones coming from the Ocean Indian. If we consider the eastern part of Africa, which is one of the most affected by flooding, especially by cyclones, we can see from year to year how the cyclones are increasing in that part of the continent. Now, we are going to quickly go through the case of the cyclone Idai that appears in Mozambique some years back. It was in March 2019. In terms of the paths, we can see that it started quite slowly with a tropical depression. It started developing from a tropical depression on the coastline of the Zambezia province in Mozambique. And we observed the first landfall in Quelimane in that area. So the following 4 days, there was a remnant low pressure that persisted over the land close to the Mozambique and Malawi border, then went to Malawi with local and heavy rainfalls associated with thunderstorms. Then from there on, floods started in the lower Likungo and Tete in Mozambique. Then we can see from the picture that the remnant low pressure moved back towards the sea, to the Mozambique channel. Moved back to the Mozambique channel here, and intensified rapidly, maturing, and then went off to the coast of Madagascar and went back as an intense tropical cyclone. Then from that time, 3 days later, it hit the coast of Beira in Mozambique. That's where the landfall of the intense cyclone started. And it was rated on category 4 out of 5 in the Mozambique scale, with a very high speed wind that really created a very heavy rainfall and flood in the country that spread to Zimbabwe. So there was an increase of the volume storage in some of the dams in Mozambique that came up to 90%, 99% of the normal volume. So some figures shows that the Idai cyclone in Mozambique affected actually 4 countries: Mozambique, Zimbabwe, Malawi, and Madagascar, though Mozambique was the most affected. We counted over 1,000 deaths, and the damages were really very costly. So we can see here how it spread around all this area of East Africa, covering Mozambique, Malawi, and Zimbabwe. In terms of human impact of the cyclone Idai, we got a very high number of people injured in Mozambique. As I said, Mozambique was the most affected country. In terms of displaced people, there were more than 100,000 displaced people, and more than 1.5 million affected people. Unfortunately, in Mozambique, the Idai cyclone didn't come alone. Like 1 month almost after the Idai, there was the Kenneth cyclone that also came from the Cabo Delgado side of Mozambique, which really contributed to affect intensely the country. So what was the impact of the cyclone Idai in Mozambique? So in terms of flooding, there was a huge, like 3,000 square kilometers of lands that were under the flood, and more than 700 hectares of cultivated land also were flooded. So you can imagine the damage. 4 provinces were the most affected in Mozambique, namely Zambezia, Tete, Manica, Sofala, actually 5, but 1 was really less affected. 1.5 million affected people, which was around 5% of the total population of Mozambique, and representing actually 11% of the population, total population of the 5 affected areas. In terms of urgent needs, almost 750,000 people were affected, mostly women and children. Over 1,600 people injured, and over 600 deaths. In terms of health impact, actually, we observed a health system disruption as it could have been forecast. We had some cholera outbreak, over 6,500 cases, more than 15,000 cases of malaria. We had malnutrition and mental health crisis, as it was described in the previous presentation. A lot of health facilities, several health facilities were destroyed, some of them partially and others were fully destroyed. We have training facilities, health training facilities also destroyed, and most importantly, the essential services were affected actually. So that really created a reduction in the utilization of health services, especially about 50% of the HIV services, for instance, were no longer functional. So this led to a long-term recovery challenges for the health system in Mozambique. In terms of social economic impact, a lot of infrastructures were damaged, estimated at $1 million, and for which the reconstruction was estimated at over $2 million. There was a lot of agricultural losses, food storage, and so on. Businesses and livelihood, businesses were damaged, and unemployment also increased because of the loss of their job of a large part of the population. Actually, there was also an increase in the poverty because the cyclone disproportionately affected poor and vulnerable people. In terms of environmental impact, apart from the widespread flooding that damaged ecosystem, displacing wildlife, contaminating water bodies with polluant and so on, there was also a huge deforestation, actually, in intense winds and flooding that uprooted trees, creating deforestation and destruction of natural habitat for many species in the forest. A huge soil erosion also due to heavy rainfall appear, and as I said about the flooding, created water contamination with chemicals and waste. So we can see here how the flooding was in Mozambique. But what exactly or how the climate change amplified the cyclone? The cyclone Idai was actually the seventh such major storm, and we can see here from the spatial map of sea surface during the developing tropical cyclone. This black contour represent the sea surface temperature value. All those species were greater than 29 or 30 degrees, showing that the warming was really very high. So one of the factor was, the main factor was actually the global warming. And this global warming intensified the strength of the cyclone. There is also the sea level rise that created more intense flooding. So what can we learn from this experience of Mozambique, actually, is that if we really want to reduce the risk of future climate-related disaster in this context or in any other country with similar context, we really need to improve early warning systems and better communication to vulnerable population. So we have many communities that were really cut off guard due to limited or delayed alerts, underscoring the importance of real-time accessibility disaster warning. Another point that need to be strengthened is the resilience of infrastructure. And then we also need to have actually a good preparedness and response capacity, because from the cyclone, we can see that it exposed the country to the real gaps in emergency preparedness and response capacities at both national and local level. We can say that also there was a problem with insufficient resources and inadequate shelter facilities that were really challenging in delivering humanitarian aid and so on. So there is also a need for a health system vulnerability, which is due to damaged health facilities. So we need to make sure that health system is strengthened. And the last point was a focus on vulnerable population. In terms of perspective, environmental perspective, there is a need in managing energy to reduce global warming. We know that there is a lot of sun, there is a lot of renewable energy potential in Africa, like solar, wind, hydro, and geothermal power generation, and also. So it's important to harness these sustainable resources and effort to restore the ecosystem and solution that will enable African countries to meet the climate challenge. In terms of health perspective, we can talk about strengthening the infrastructures and early warning system, building climate resilient health systems in these countries, and then ensure preparedness and readiness for health and humanitarian emergencies. So in conclusion of this situation in Mozambique, it really helps us understanding that there is an urgent need for transdisciplinary collaboration, which is really critical for government, NGOs, and communities to work together, integrating expertise from fields such as public health, engineering, disaster management, and so on, to ensure a comprehensive response and preparedness. There is also a need for a paradigm shift in climate change awareness. Actually, a shift of mindset is important, is necessary, with government and stakeholders recognizing climate change as a serious, urgent issue. To get there, it requires embedding climate risk considerations into all levels of planning and development to mitigate the increasing frequency of extreme weather events. Another point is to leverage existing capacities. Actually, many countries in Africa, including Mozambique, that are affected by such event must really maximize the existing capacities, such as using local knowledge, leveraging regional and international partnership, and strengthening early warning systems. There is also a need to tap into natural advantages, like I said previously, such as renewable energy resources that can also aid in sustainable development of disaster resilience. The next point is building climate resilient infrastructure that can withstand extreme weather event. Actually, this includes reinforcing public infrastructures like hospitals, schools, roads, and so on, and ensure that they all remain functional during and after such a disaster. And then the last point, but not the least, is to empower the vulnerable communities. We know the importance of the community in the changing environment of humans. So we need to really empower, especially women, for instance, that are working, and children also, and all these poor communities and so on, those who are really disproportionately affected by disasters. So this will help ensuring also equitable access to resources, and it will be very important to integrate these communities into the preparedness planning to make sure that we can guarantee resilient communities. I think I will stop here. As I had only 20 minutes and we have reached 20 minutes. So this is what I could have presented as a case of these extreme weather events impacts in one of our countries, and which was actually one of the most affected in the continent in 2019. Thank you. I'm Peter Mbondji.
Thank you, Dr. Peter. Please, if you want to clap for him, you can use the clap hand button. But Dr. Peter has brought to life our topic today, whereas Dr. Kutane has given us the overview of extreme weather hazards. We've seen how this has actually impacted in real life scenario, and that is what the case study is all about. Just to make us understand that climate change is not a theory, it's actually something that is complicating and exacerbating health situations and challenges within the continent. And I'm happy with the multi-sectorial participation from different stakeholders in this program. And I'm happy that we've all seen that across our various segments, we have a role to play. And the best way to maximize that role is to be able to collaborate, coordinate together, and work together in a One Health team that looks at health from a holistic perspective. At this juncture, we'll take questions, and we have quite a number of questions. So we're going to take the first 5 questions for Kutane, and then we take another 5 for Dr. Peter. And if time permits, we take we'll run through that cycle again. So Dr. Kutane, I'll take those questions in series, and then you can answer them collectively. So the first question in no particular order is, what metrics are used to define an extreme weather event? And to what extent does the use of this language impact climate action, considering regional variations in the threshold of what qualifies an extreme? That is one. The second one is, what are the steps taken by the African leaders in their countries to fight against these extremities caused by climate change? The third one by Eunice Damisa, how do we build synergy between a country's meteorological sector and health sector to ensure early warning constitutes a mandatory part of health surveillance? Again, how do we build synergy between a country's meteorological sector and health sector to ensure early warning constitutes a mandatory part of health surveillance? The fourth, can earth conflicts lead to meteorological problems? Can earth conflicts lead to meteorological problems? And lastly, your fifth questions for Kutane, what are some of the interventions that can be implemented at community level to improve the coping capacity of that community? What are some interventions that can be implemented at community level to improve the coping capacity of that community? So I'll open it up to you, Dr. Kutane, to answer these questions. Over.
Oh, sorry. The question is too much. So the last question, the fifth question is, can you repeat the fifth question, Dr. Charles? Hello?
And maybe you can take the first 4 that you got clearly, and I'll repeat the fifth.
Okay. So what qualifies the extreme? And then what qualifies the extreme? How African can fight? What is the synergy between the meteorology and health for the early warning? Can extreme lead to conflict? All those things. I'm trying to touch. I think what qualifies extreme, I think we try to define the extreme. It follows that definition. As I said, this is happening now. How we are relating to the climate change. This is happening because of the natural process. That is why I brought the hydrometeorology. This is happening, the weather is happening because of the interaction between the water cycle and then the whole process. The whole process of the hydrometeorology is very important for the extreme. This is happening because of the natural causes. For example, the La Nino and the El Nino. I didn't brought it here, not to confuse. Is happening because of the natural cause. But after the pre-industrial revolution, because of the addition of the human activity, burning of the fossil fuel, the human activity brought the aggravation, in terms of frequency, in terms of intensity. So it is happening, this is happening through the hydrometeorological cycle. So that is how it qualifies. In the normal situation, the rain is, for example, the rain is raining. For example, the cyclone my colleagues have presented. During the normal process, there is no problem. But the event is happening in an abrupt way, in normal ways. So that is when the cyclone is happening. So I think the threshold is when it is beyond the natural process. For example, the rain, when the normal rain is happening, nothing is going to happen. But if there is a heavy rain mixed with a wind, like the cyclone, the tropical cyclone, that is where we call, that is the threshold. It affects the property, the human life, and all those things. So the threshold is like that. It's deviating from the normal natural course of the climate patterns, what we call weather. That is why I call them the climate pattern. When the climate pattern is deviate from the natural course, that is when the extreme weather is happening. How Africa is fighting? I think I tried to mention in my presentation, for Africa to address these gaps. As I said, Africa need to strengthen the early warning system. Myself and also my colleagues, the second presenter, Dr. Peter has already said. So Africa need to strengthen the early warning system, not only for health, for the whole sector. Health is part of it. Number two is we need to improve the infrastructure, resilient infrastructure, like the urban drainage, the road infrastructure in the rural area. We need to improve, the African need to improve the infrastructure. It is linked not only the humanitarian response. The way we are operating in Africa, when this extreme is happening, we respond, we stop. It comes, like what is happening in cyclone in Mozambique. I was in Mozambique for 4 years. So when the cyclone goes, everything went to the normal one. There is no recovery. There is no building the resilience, as I showed in my last slide, to bring above the normal so that the system is resilient. So we need to improve the infrastructure. We need to improve also the agricultural practices. And then, so these are the areas where we need to focus for Africa. And then also, we need to increase climate adaptation, investing in climate adaptation. I already said. And then we need to strengthen the governance and the policy, building community resilience, and then international cooperation in the funding. For example, the community resilience. The community resilience, when there is a flood, the flood or drought is coming. Let me give an example. More than 1 million cattle was dead in Ethiopia like 5 years before. But we know the drought is happening in that area in a cyclic manner. So there should be an insurance mechanism for that community, or there was a prediction, but those cattle can be moved from those areas. So these are the small, that is why we need to develop, to strengthen the governance, building the governance of strengthening the governance in the policy. What are the insurance mechanism for those prone areas to drought? What are the insurance mechanism to those drought prone areas? How those prone to drought area is making in an area where their livelihood is not going to be affected by the flood. So those are, it can be, is a local level adaptation plan we need. That is why we need the vulnerability assessment. We cannot apply blank intervention. We need to have localized the intervention because the extreme weather event is happening in a local context. So we need to have the vulnerability level to what hazard, what are the coping mechanisms for that hazard, so that we can ensure resilience. As I said, the insurance mechanism and also the infrastructure, how we are going to build in those areas, the school, the healthcare facility. Where are the areas where people can move when those events happen to the high areas? For example, in areas prone to cyclone. Those are the local level detailed adaptation plan we need to implement at a community level. So as I said, the international cooperation is very important to build the community intervention, the community level resilience intervention. I think I've tried to touch.
Yeah, you've touched on all of them. I think to a great extent you've touched on those 5 questions. So let's pick out some other one for Dr. Peter, and then we can come back to you if time permits. So Dr. Peter, maybe to make it easier, I'll give you 2 questions first, and then after the answer, I might give you another one. So the first question is, what can you say about the recent flooding in Maiduguri, Nigeria, where 70% of the state was affected? What could be the long-term effects, especially with regards to waterborne diseases? That's 1. And 2, knowing that the management of natural resources is too weak in certain African countries, what can we do to improve our system of sustainable management of the ecosystem and the environment to reduce climate change a little? Over to you, Dr. Peter.
Okay, thank you for the question. The first one was that 70%.
The first one is, so in Maiduguri, Nigeria, 70% of the state was affected by a recent flooding. So the question is, what could be the long-term effects, especially with regards to waterborne diseases?
Well, let's say when you have a state where 70% of the state is affected, that's really a very important disaster. And the fact is that we really need to put in place some strong measure, especially in terms of aid that will help the country to recover quickly. But if you have 70% of the place affected, that means you will have almost 70% of the population also that might be affected. So it's important now to imagine a plan where we can then mobilize enough resources, first of all, to build some, to respond actually to this humanitarian emergency in terms of saving people. There is a need to reinforce also the infrastructure for relief and so on, and that will help also organizing it. I think working with the community will be very important as well, because, and that's where we were talking about as preparedness, about empowering the community, because this is where we need to have all the hands together and so on. Now, to avoid it, obviously, it's important to really prepare for that, and it is important to empower community to organize themselves in such a way that they can evacuate easily, they have some way of really getting out of this zone anytime. So I think, yeah, I think if we apply those and we make sure that we can have a good coordination of humanitarian response, including logistic chain and things like that, yes, we can then try to save lives there.
Yeah, so maybe as a rejoinder, the person asking this question is concerned, should they be worried of waterborne diseases? Do you think that will be of impact as a result of this flooding? And what do they need to be able to do to mitigate that if it happens?
Yes, definitely. I think such flooding can only lead to waterborne diseases. So in terms of mitigation of these waterborne diseases, there is a need for improving water and sanitation infrastructure, for instance, and make sure that we have a good wash activities there. The water will probably be affected also by the disaster. So working towards water treatment, promote the use of water treatment and so on will be very important. In terms of empowering community, it will be important to have a kind of hygiene education, to educate community on the importance of hand washing with soap and so on. I mean, maintaining good hygiene practices to prevent all these disease transmission. But above all, it will be important to put in place a good surveillance and monitoring system. I mean, to strengthen the disease surveillance system, to detect any, to early detect any case of cholera or any other waterborne disease and respond rapidly with the appropriate intervention, public health intervention. I think there is also the emergency response that should be very ready. Actually, that should be prompt to respond in terms of water purification and so on. Those tablets, hygiene kits should be available during the whole time of the crisis. So I think by implementing those little activity which are all around the water treatment and water sanitation and hygiene infrastructure, including education of the communities, will be very important to mitigate the waterborne disease outbreak.
Thank you very much. Just quickly, 1 minute, maybe straight to the point on this one. This person wants to know that besides deaths, were other health outcomes quantified after Cyclone Idai? Besides deaths.
Excuse me?
Yeah, besides deaths, in the Cyclone Idai, which you talked about. So are there other health outcomes that were quantified besides deaths? And if none, are there plans to do so, or how can that be done? To quantify other health outcomes that would have emanated from Cyclone Idai. Just 1 minute.
Okay. Apart from the cholera outbreak that were identified during that I listed in my presentation with those 6,000 cases, I said there was also a huge malaria surge with over 15,000 cases, I think, something like that. But there were also malnutrition, as I said, because of this displacement of people and the food shortages. They all contributed to malnutrition, especially among children and so on. This was mainly due to destruction of crops.
Yeah,
And there
thank you
is
so much.
legal issues as well. This is very important. That's why I insist to list it also.
Okay, thank you so much. I think those are
Dr. Charles, 1 minute on the meteorology issue. I didn't touch it. 1 minute.
Yeah, Dr. Kutane, just as you take 1 minute to touch on that, I want you to also touch on this very important question. Early warning depends on data, but in Africa, we have a challenge of data quality and access. How can we bridge these data gaps in Africa? So please take the 1 minute to talk about this too, quickly. Thank you.
Yes, thank you very much. I haven't touched this one. The synergy between the health and the meteorology, especially for the early warning and the data quality. Let me give my experience on this in Ethiopia with the meteorology agency. So it's very important because the meteorology is a kind of institution selling the data. But you know, the health sector need a huge data. Over the last 15 years, when I used to working with them, they are having a daily data. So they are having a daily data for the climate patterns, which I've already mentioned in my presentation. So there is a need to have a memorandum of understanding with the health sector so that the meteorology provide the health sector. We have this experience. Now for the health sector, they can get from all the meteorology station in Ethiopia. We have a number of meteorology stations with the different kind of met stations with a different level from small to high. So it's very important to have the memorandum of understanding between the meteorology and the health so that they can provide on a regular basis the data to the health sector. And then the health sector can overlay with epidemiological data to predict those climate extreme weather event related diseases. And then they can produce to the level we used to have now the biometeorological bulletin for health produced on monthly basis and predicting those extreme events like heat and also the malaria and other other diseases. Now we are moving how to predict the cholera. We have now for the malaria, we are planning to move to the dengue and the yellow fever since we are having this outbreak in Ethiopia. So once that memorandum of understanding is signed, there is a need to build the capacity in terms of IT equipment, in terms of also the human resources, the human resource capacity, how the meteorology station is, the meteorology professionals is providing relevant information for the health sector. For example, in Ethiopia, when we used to have the training for the early warning of climate sensitive disease, the training is happening not only for the health workers, we used to train the meteorology staff also, so that they can understand what is the need of health. And then when the health professionals request, the health colleagues request them, they provide the necessary information. So that is how we need to work to improve the data quality, strengthening the capacity of both, and then having a memorandum to have a free data for the health sector, not only for the health sector, for the agriculture and for all sectors. Thank you.
Thank you so much. Colleagues, what Dr. Peter and Kutane has said is for us to have a holistic One Health approach that brings all the sectors into health to be able to understand the specific roles they need to play. And we work together to be able to manage our health system, strengthen it, make them more resilient, and make our populations more resilient and adaptable to climate change. Climate change is real, and its impact on health can never be overemphasized. Thank you for your attention to this session 2 of this program. And as we log out, please, we have on the screen the post-session survey. Remember that as part of the certification, we need to have all of these inputs documented. So you can either go to the link on the chat, or you can actually take the barcode and you respond to the evaluation questions. I want to appreciate the presenters. Kutane, thank you so very much. for making our time to be able to give your presentation despite traveling to the greater part of today. And Dr. Peter, we appreciate your insights on the case study. And to the team that have been behind the scene trying to manage this whole system, we want to thank you for all your efforts. And we meet again on Tuesday. So let's take the next 2 minutes. The screen will still be on to do the evaluations. Also to highlight that the recordings from this today's session, and I'm sure the first session will be shared. At least today's on after 24 hours, you should be able to access it. And if you don't get it on your mail, you can actually go to this course website and you can actually access all of this. Thank you so much and have a blessed evening.